Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. We're so delighted to have you. Don't touch that dial. We've been talking about cardiac disease and hearts with Dr. Myrna Alexander, the first female interventional cardiologist in the state of Mississippi, happens to be African American, grew up in Biloxi, trained in Tougaloo College for undergrad, went to Meharry for her medical school, and then pursued her cardiology, her internal medicine and cardiology fellowship in Michigan, and she has returned to the state of Mississippi to work currently at the University of Mississippi Medical Center. And we're so delighted. She's a wife, she's a sister, she's a daughter, and a mentor to several who look up to her in the field of medicine. So we're honored, delighted, and enthused to have her on the show today. She's going to crack you up with her jokes and her background, and just interested in her pursuit of excellence, because it's not everybody who pursues excellence to that point. Cardiology is a very is a field of very few mistakes. You cannot. I call it the margins are few.
Yeah.
You can't make too many mistakes in
No.
cardiology and get away with it.
Hmm.
So for you to be a cardiologist and an interventional cardiologist at that, you must have that dexterity and ability to keep your margins to the least possible. And she's had her fair share of experience in the private sector, now working in the public sector. But we cannot talk about cardiac disease without talking about diet and exercise. So tell me a bit about that in Mississippi, in Louisiana, the two most obese states in America. Do you think our diet, do you think the prevalence of obesity is a huge role factor in this pandemic of cardiac disease that we see in our states currently?
I really do. I mean, it's not just obesity, though. It's not the, I can't pin it on just that one thing. And I tell my patients, you can't make a cake with one ingredient. And so to have cardiovascular disease, you have more than one ingredient. So if you got family history for heart disease, you have hypertension, diabetes, and so what begets those? Sometimes obesity causes diabetes, and then obesity may cause some hypertension. Although I have some small women, some small men who have hypertension. So it's not just that. But if you really look at those small people, they may have a high sodium diet.
Diet.
So even though they're, the BMIs are 25, and I ask them, okay, you work as a lawyer. What do you do for lunch? Oh, I may go to Chick-fil-A and grab this, that, and the other. So they may go to a fast food restaurant, and
Mm,
then they're high in sodium content.
sodium.
So, that's why we have tried to talk to um, not just the hospitals, but the providers for our foods, the industry,
Hmm.
about changing the sodium content in what we're getting, because it's going to everybody. It's going to our children, to me, to you, and so that impact is
So you
making a
don't
big
think
difference.
it's just the African American pigtail, pork skin? I'm just saying
No.
the things that
Mm-mm.
African Americans may indulge in more than other races.
I see hypertension in whites and Indians. Now, our Native Americans, they have a lot of diabetes and hypertension and,
Hypertension.
and heart failure. I see quite a few Native Americans with congestive heart failure. So there are other problems with Native Americans, such as depression, alcoholism, that kind of thing. So you got to look at each culture,
Hmm.
and so what problems in one culture may be different in another culture, but we're all in this same pot together. But
Hmm.
no, I see we're all, in Mississippi. We're all sitting and we're all going to eat the same stuff, and
Hmm.
we might be a different complexion, but when we look inside, they're the
It's some
same
of the same food.
atherosclerotic disease. Yeah,
Right.
they're the same atherosclerotic disease. Now the propensity may be higher for
Hmm.
hypertension, but we're seeing them younger now. 15, 17. Because what did it? My son, I had to get on him about eating high sugar foods, high salt foods, that kind of thing. But that's what they do. They buy a bag of chips. They drop by the fast food restaurant to to eat. Where I'm saying, okay, I fixed dinner. What are you doing? Oh, well, we don't want that. We don't. So yeah, I think there are environmental conditions that
Conditions.
are, that are impacting us. So if I go back and I look back at some pictures of us from high school, the majority of the people were not heavy people. They
Mm,
were smaller people. They're getting to be a little heavier,
mm.
but I do think that obesity plays a part, but it is not the only ingredient.
And apart from diet, lack of exercise, there's cigarettes,
Right,
there's alcohol, there's lack of sleep, sleep
right.
apnea, so all that can play a huge role in the long-term mortality and morbidity. Recently, you added a new title to your calling. You became a professor in the medical school.
Hmm.
So, what does that confer on you? Because all through you did private and public, so you did private sector work. You never
Right,
really did
right.
academic work. So, was that you wanted to do something different in those last years of maybe your practice?
Right. So I actually, when I was at Henry Ford Hospital, I was teaching. So
Okay.
for 2 years after I finished my fellowship, I was doing some teaching, as long uh, as well as doing interventional cardiology. But I had no family in Michigan, and
Mm,
my duties that the Lord sent for me to do were over, and I came home.
oh,
And so there are different phases, and you'll see it as well in your own life. Um, there are different phases of what we do, and where you're taken. You've got to be guided, by the Lord about what you do.
mhm,
I would say initially, when I was a young doctor, I wanted to go to Atlanta. Okay, I
mm,
thought, okay, that's the place to be. But I ended up in Detroit. I loved it.
mm,
Then when that was done, one of my best friends asked her brother-in-law, Dr. Malcolm Taylor. They were looking for a partner, and I thought, I don't know if I want to go to Jackson to practice. I was looking in New Orleans, still looking in
mm,
Atlanta, and just happened. Malcolm called me, and I looked at their practice, and I loved it. I spent
mm.
16 years with them.
Awesome.
But after that, now I'm married, got a child, and trying to figure out where you go next. And I've always liked teaching, and
Uh-huh.
I've always been engaged with residents.
Resident.
They keep you on top of your
Uh,
toes, yeah. And so that's why I went to the university, but not just for me, to start a women's heart clinic.
oh,
Yeah.
okay. You
So
have a women's heart clinic.
yeah.
Okay.
And so right now my focus is cardiobstetrics.
Oh,
So there's a high risk for maternal mortality, and it's due to cardiovascular disease. So the number one cause of death during pregnancy now is cardiovascular.
right,
Can
right.
you believe that? Okay. So now I feel like that's something that I've enjoyed doing, trying to
Mm,
prevent a problem during pregnancy. We have quite a few women with dilated cardiomyopathies,
right.
hypertension, preeclampsia, and that we just have to take care of them. They're only in their 20s and 30s,
Hmm.
and their children will be impacted.
Yeah, I
Well,
actually saw one of your patients who delivered twins at 25 weeks, and she had uncontrolled high blood pressure.
yeah.
She's a nurse at UMC. One of the twins didn't make it,
Oh,
but
yeah.
she said you put her on nifedipine, and so she saw me after she delivered. She needed to continue it. I said, yeah, continue it because your
Right,
blood
right.
pressure is kind of high for
Yeah.
somebody who's that young. So definitely, these are
Yeah,
patients
yeah.
with, serious conditions
Right.
that need some attention. So um, tell me a little bit about what you think genetically we should be wary of as patients. What should a person think of genetically if he's at risk? If my father had heart failure, am I at risk? If my father had a heart attack, am I at risk? Is it more environmental? Is it more genetic? Do we have a genetic link for heart disease? We tend to have it for schizophrenia. We tend to have it for diabetes.
Right.
I'm not sure if there is one for
So
heart
no,
disease.
we do. We do have
Hmm.
a link for heart disease. The Framingham study proved that.
Okay.
Okay, so in Framingham, Massachusetts, and now the Jackson Heart study is trying to make sure that we look at other um, factors that may affect African Americans. But we
Hmm.
do know that family history matters. So even in my own family, my dad had heart disease. All of his siblings had heart disease. That aunt that I'm telling you about, I got two aunts actually, but the one had, both of them have heart disease, and they'll tell you, but
Hmm.
they're living with it. It's a livable disease.
Right.
So when you find out that you have it, it's not the end of your life. It's just something that you got
You
to
have
live
to
with,
live with.
and you got to make some changes to stay here
Hmm.
longer.
So tell us about your practice in Meharry. You were focused on education. You didn't get married until after you returned to Mississippi. Was that
Right,
a
right.
deliberate, let me use the word, tactic to avoid distractions, or was it just
No,
okay?
it wasn't deliberate, and so and our young women are probably going through the same thing now,
Hmm.
and so the when you're in school, young women and men are going through the same thing, trying to find a mate. Okay, trying to find somebody that you're compatible with is because it's a part of life. So medicine is not just my life,
Hmm.
but yeah, it wasn't deliberate when you run into somebody, you see somebody, you're dating someone. That's a part of life, and that's something that you will have to go through to get to uh, wherever you are now. No, it just happened that that mate that you may have thought you had was not the person. So when I
Okay.
came home, I met my mate here at Tougaloo actually. Uh,
Oh, he was teaching. Oh, he was.
he was teaching. No, we were at a um, a function at Tougaloo on the
Okay.
grounds at Tougaloo when we
Oh,
met. Yeah, it was
wow.
a Founders Day event.
That's awesome. And
Uh-huh.
you told me just now you had a son. Is that
Right.
correct?
Uh-huh.
Okay.
Yeah.
One or two or three or.
So we have a blended family.
Okay.
So my we have um, three sons and
Hmm.
one daughter.
Awesome.
So the sons and daughters of my husband, they're much older,
Okay.
and we have a 21-year-old.
Oh wow. Okay.
He's
Awesome.
the youngest.
He's awesome. That's awesome. Because a lot of women face those career decisions. Should I, have a baby in the middle of residency?
Hmm.
Should I stay at home after my breastfeed for 6 months?
Right.
Little questions like that that, the people don't teach you before you enter medical school, which can define
Yeah.
your time in residency and medical school.
So not only do they not teach you, it is become a taboo subject for even the professors to ask you about.
Right.
However, if you develop a relationship with your residents and fellows, they don't have any problem stopping by my door talking
Hmm.
about
Right.
what they want to do. So I really encourage them not to put their lives on hold
Hmm.
because many of them, um, black and white, I talk to about what they plan to do later on. You don't want to wait till you're 35, 40 years old, and
Hmm.
then you're talking about in vitro and all of this stuff. Just, and I tell them, hey, your male colleagues are not waiting. Okay, they are going ahead and having
Going
family.
ahead, right.
But when we are made not to mention things in an interview,
Right,
you
right.
can't
You
talk
can't talk
about
about
certain
that.
things. You can't talk. But they are itching to know.
That's right.
Yeah,
Yeah.
I mean they're itching to
Hmm.
know what to do. What did you do? But it's still a conversation I think that needs
Hmm.
to be had.
You
But
mentioned earlier the role of faith in your work.
hmm
So tell us a bit about. I mean, first of all, you're growing up. You said there was a church role. Your parents played a role. Your mom was a Sunday school teacher. How did that affect you going into college? Did you? I know you told me you had a wild time in college, but
I didn't tell you I had a wild time. I told you
you
I
said you
had a
had a great
great
time.
time.
Okay, you had a great time in college. So
Right,
let me
right.
not put the words in your mouth.
No,
So
no.
how did your faith play a role in your career
Uh-huh.
today? I mean, did you have a relationship that maybe fostered your current progress as a cardiologist, or
Oh
how did
yeah.
God play a role in all
So
this?
God plays a role in everything I do. So
Mm-hmm.
I prayed through everything we've done, and my parents have taught us to do that.
Mm-hmm.
Um, since we are on the coast, we have been stricken with storms all of our
Oh,
lives. So I just remember I was a Camille child. I remember being in school at the time. It's dark. The water is up already
oh
from,
wow.
yeah, already up to the eighth step of the
Mm-hmm.
first floor. And I'm asking Mama, hey, Mama, what's going on? Are we gonna be okay? And she said, yeah, you just pray and you're gonna be all right. The next morning, it was
Wow.
sunshine.
Okay.
That water receded, and so she has taught us to pray, and not just pray, but to pray and have faith that what you prayed about will
Mm-hmm.
the Lord will
Come to
bring you through.
pass.
Yeah.
Awesome.
Uh-huh.
Wow.
So in every step of my life,
Mm-hmm.
I've not done everything right, but you got to listen to what He's telling you to
Wow.
do.
Did
Um,
you, if my viewers are watching, they want to know if I was going to pursue medicine, what courses in high school and college should I emphasize in undergrad? They want to just know how to get themselves ready for a
right.
career in medicine
So you can go to medicine even if you're a uh, you got a
major.
history major, right? But you gotta have science classes. Okay, so
Mm,
you can't just say I'm a history major and I'm gonna go and be a doctor. You gotta have some interest in what we do. So they need to take biology
okay.
in school. They need to make sure they got advanced maths, chemistry. In high school nowadays, they even offer anatomy and physiology. If your high school
Offers
provides
that.
that, make sure that they take that. Don't be frightened by it. If I can do it, anyone can do it. And I think fear stops a lot.
Oh,
Yeah. So,
so
but if you just got to have faith that one human being can do it, this
you
next one
can.
I can do it as well. Yeah.
So when you returned and you were told you were the first female interventional cardiologist in the state, how did you? The question is, how did you feel? And then,
Okay. Number one, I didn't know that.
okay,
No, I didn't know that. And I came from the
Michigan.
Midwest, is
Hmm.
trained from the Midwest. Well, there were women already before me. This was not a big deal in the
Hmm.
Midwest. It just was a big deal in
Yeah.
Mississippi because there weren't many that were interested in cardiology.
Hmm.
But no, there were women in Michigan that were making all kind of moves. There were some that were doing big studies that bring us to where we are now.
Right.
There were women that over studies that says it's better to do stenting versus um, thrombolytic therapy. These
Uh,
are women that were over those studies.
mm,
Cindy Grimes was the woman that did that study, and that was 30 years ago.
wow.
So for me to say you're the first interventional woman, well, I didn't know it. So it was brought to my attention by somebody else.
Mm.
But I'm just working.
How
Uh,
did? Why did you pursue interventional after cardiology? Because I know a lot of your residents and fellows are just happy to the door after fellowship. They just want to get out and make what they can and settle down.
oh, being
So
in the
why
lab.
did you pursue I interventional after the cardiology fellowship?
Oh, because I loved it. I like
Oh,
being in the lab. I mean, it's rewarding that somebody comes in with a heart attack and you can take them to the lab and you can open that vessel up and then those people are better and they can go to the room and the next morning they're standing at the door. I'm ready to go home. What's taking you so
right.
long? I'm ready to go home. So it was very rewarding. Um, I was always pretty good with my hands
Mm.
and with procedures, and so that was not an issue. Procedures was not a big issue for me.
And it was just an extra year.
At the
Okay.
time, it was an extra year. So now cardiology has really blown up, right? So now we have structural heart disease,
Hmm.
which is 2 years extra, on top of your 3 years. But I think not think it's all better though because now you can get a valve placed. You don't have to have your chest cut.
Open.
It's better for the patient that we
Mm-hmm.
get extra training so that we're not having problems with making mistakes and stuff. So
Right.
that extra training will pay off for the patient.
Wow, that's awesome. So Michigan was a little bit. I mean, Henry Ford is part of the. Is it part of the University of Michigan system?
No, so the people from Michigan would come and rotate at
Okay.
Henry Ford, but they have their own residency program.
It was an inner city hospital.
Mhm.
Okay.
Yeah,
'Cause
it
I think
still
I've
is.
heard of it. It's
Yeah,
pretty busy.
it's a busy and
Okay.
it's a big place, and they have other hospitals around as well.
Hmm.
Yeah.
So if somebody has a stent, from your experience way back when you did interventional cardiology, what are the precautions that person must take
Okay.
after he has a stent?
So once the stent goes in, they need to realize that that's not the end of their treatment.
Intervention.
Okay, because some of the other areas in the blood vessels can narrow as well. So they got to take aspirin. They got to take some other medications like Plavix, which is clopidogrel, some other medicines that we prescribe to keep the stent open. Just knowing that the other vessels in that tree, in that
Mm,
vessels, um, can also narrow. So that's why prevention, this is what we call secondary prevention.
okay.
You don't want a second problem. So that's why don't consider, oh, they fixed that, I'm feeling good, I'm doing well, I can get up and I can move around now. Well, in years and months later,
Mm.
months to years later, you can have narrowings in some of the other vessels. So
So you have to
it's
keep
important.
taking the
Got
medicine.
to keep taking the medicine, keep getting your cholesterol, your blood sugar, all of those things need
Mm.
to be in check.
There's a bit of a controversy between interventional cardiology, let me use the word vascular surgery, and maybe orthopedics about PAD. There's
Hmm.
some quarters that institute that we are doing too many amputations because we don't maybe use the word thrombolize or thrombectomy for the lower extremities like we do for the heart. So the question basically is, why do we do less thrombectomies, or let me use the word thrombolysis, I think,
Hmm.
for the vessels in the leg? I don't know if that's your turf.
Hmm.
Why do a lot of our patients with PAD end up having
Amputations.
amputations if there's another way we can save their legs through interventional cardiology or vascular surgery? That's
Mm.
just, you know.
The main reason is the same reason for those heart attacks that occurred is that they wait too long. Okay, so you got to recognize the symptoms first.
So
So
PAD and CAD are like sisters. They
yeah,
follow
and
each other around.
I tell the
Okay.
patient it's like being on a highway that's nice and smooth. So the highway has lumps and bumps on this road, and then if you go below on the legs, they got lumps and bumps down there. But if you on a German road and you can go as fast as the blood is going fast, right? If you come to Jackson, you gotta so the streets are different, but the same thing with the vessels. So that if you got narrowings in your heart, you can have narrowings in the blood vessels to your brain and narrowings to the legs. So what are the symptoms of PAD, peripheral artery disease? Patients trying to walk, and the
Mm-hmm.
patient starts having pain in the calf, and they may be able to walk 10 feet. That's really short. Or they may be able to walk a block, and then half the block they got to stop because their leg starts hurting, or and that's the most common symptom
Right.
is discomfort, or they
Claudication.
just
Right.
can't walk because of a decrease in blood flow. So that can be investigated by your primary care physician. We can get tests on the
Mm-hmm.
blood vessels. The first test is the physical exam, just feeling the
The
pulses
pulses.
in the legs, so make sure your doctor, when you go to a doctor, make sure that that doctor examines you, meaning check your pulses in your neck, in your groins, in your feet. If they don't touch you, you might need to find another doctor that will examine you.
Because a lot of people are having their feet amputated, and We're
They
wondering.
waited too
They
long.
waited too long.
They waited too long.
Smoking is a big reason
Yeah.
too. Diabetes uncontrolled is a big reason.
Right.
Do you do anything for PAD, or do you just refer them to vascular surgery?
So when you say me, so
As
since
a
I stopped doing interventional
Okay,
cardiology about 10 to 12 years ago, I'm a clinical cardiologist now, so I'm not doing interventional anymore. I have partners that will do that kind of work,
okay.
cardiologists. So
So
there are
okay,
cardiovascular
but what does
cardiologists.
interventional cardiology do for PAD
That's
as
what
a
I'm about
special?
to tell
Okay,
you. Right. So yeah, we have one. All of them can do it, but we have one that have a particular interest
okay,
in doing it in our lab. But if you go to some other cardiologists, there are multiple people. So the same stenting or the same ballooning that we do in the heart, the vessels are bigger, and so we
mm,
can balloon and stent and rotor blade in the vessels
wow,
to supply blood supply to those
okay,
vessels. But you want to get it early. You want to
mm.
make sure that the symptoms, that you know your symptoms early.
So stenting in the heart and stenting in the lower extremities as
Right.
well.
So cardiologists uh, uh, do that.
Mm,
The vascular surgeons stents as well, but they don't do as much as we do. They
mm.
do a lot of big vessel stuff like um,
Bypass.
yeah, bypassing. They do a lot of bypassing the blockage, or they're stenting aortic aneurysm. So
Right,
that's their
that
department.
department.
Right.
We've been talking with Dr. Myrna Alexander, and she's been sharing with us her heart for cardiology, her heart for family, her heart for patients in general. She's walked in the hallways of some of the biggest hospitals and has returned to serve, like she rightly said in her own words, the people who nobody else probably will serve. And she's done a miraculous job helping train the next generation of cardiologists, and we're so indebted to her. Next week, she has a treat for us. She's bringing her younger sister on the set to share the spotlight with her. That's the kind of person she is. And we're going to be asking them some questions about their upbringing and how both of them, both in the same family, ended up becoming physicians. You don't want to miss it. Don't forget, Jesus is Lord. God bless you.
The next day, right now.